Botox is actually a purified protein. A lot of people think that it's a poison when we're injecting people. It really isn't. It's a purified protein from the botulinum toxin. And we've been using Botox for over 20 years now. I was actually trained by the mother of Botox, Dr. Jean Carruthers. That was back in the 1990s. And we perform Botox every day of the week here at the Cuba Skin and Laser Center, sometimes 5 or 10 times a day. Botox treatment is very quick. It depends on the number of areas we treat. We can treat the frown lines, the forehead, the crow's feet, sometimes around the mouth and the lips, and often the platysmal bands right here in the neck. And it usually takes less than 5 minutes to treat each area. When we inject Botox, you hardly feel anything. For some people who want numbing cream, we can put that on before, but you barely feel it. It's really a tiny needle, so it's really very comfortable. When we perform Botox injections, there are very rare side effects. I mean, occasionally you can get a little bruising from the needle, but if it's not done properly, you can actually get drooping of the eyelid, and that's extremely rare. With good technique, that really should not happen. Botox lasts usually between 3 to 6 months in most people. It can be less or it can be longer, but most of the time it's between 3 and 6 months. The cost for Botox is really minimal. It's usually a few $100s per area, but it depends on how many areas we treat. We've also found Botox to be very effective for hyperhidrosis, which really means excessive sweating. So we can inject it in the underarm area, on the palms, and also on the soles. I usually tell my patients that they can see results from the Botox as early as several days after the treatment, and sometimes up to a week or two, but it's often very quick.